Ever wondered about the tiny yet mighty ticks and the potential dangers they bring along? Posing a threat to outdoor enthusiasts and pets alike, these small arachnids are carriers of numerous diseases, including Lyme disease and Rocky Mountain spotted fever. So, how does one prevent and handle tick bites? Here's a step-by-step guide. First off, don a protective armor. Cover as much skin as possible with long sleeves, long pants tucked into socks or boots, and closed-toe shoes. This simple act can be your first line of defense against these pesky creatures. Next, arm yourself with an insect repellent containing DEET or picaridin. Apply it to exposed skin and clothing, always abiding by the instructions on the label. While enjoying the great outdoors, try to steer clear of tick hotspots. These are areas with tall grass, bushes, and woods. After a day outside, conduct a thorough tick check. Pay particular attention to the scalp, behind the ears, under the arms, inside the belly button, around the waist, between the legs, and behind the knees. Taking a shower within 2 hours of coming indoors can help wash off any unattached ticks and make it easier to spot and remove any attached ticks. And don't forget about your furry friends. Regularly check your pets for ticks, especially after they've been outside. Now, if you do find a tick on your body, remove it promptly. Use fine-tipped tweezers to grasp the tick as close to the skin surface as possible. Pull upward with steady, even pressure. Avoid twisting or jerking, as this can cause the tick's mouth parts to break off and remain in the skin. After removing the tick, clean the bite area and your hands with rubbing alcohol, an iodine scrub, or soap and water. Keep a close eye on any symptoms that may develop, such as fever, headache, muscle and joint aches, fatigue, and rash. If you notice any of these, seek medical attention promptly. If you have concerns about potential illness transmission, save the tick in a sealed container with a damp cotton ball and date it. This can help healthcare providers identify the tick species and assess the risk of disease transmission if you develop symptoms later. In summary, protecting yourself from ticks involves wearing protective clothing, using insect repellent, avoiding tick habitats, conducting regular tick checks, and showering after being outdoors. If you do find a tick, remove it promptly, clean the bite area, monitor for symptoms, and save the tick if you're concerned about potential illness transmission. Remember, early detection and prompt removal of ticks can help reduce the risk of tick-borne illnesses. If you're unsure about how to remove a tick or have concerns about symptoms after a tick bite, don't hesitate to consult a healthcare professional. Be tick-wise and stay safe out there.